Hi there. Do you suffer from knee pain? Does your knee give you a problem that you struggle going up and down the stairs or walking up and down the steep slope? Or sometimes after you're working out to the gym where you've not had any pain, when you're resting and let's say you've gone for a meeting and standing up becomes a problem. Or sometimes this pain even it's limiting you from doing your bridge or your lunge kind of exercise. You've gone to the doctors, you've done the MRI, you've done x-rays, but there's nothing. You've taken painkillers, but still, this pain still lingers on. Probably you've done a bit of physio and it goes and comes back again. How do you deal with this problem? How do I go about this? Welcome to Most Physiotherapy Center, where you receive your touch of care and the tips to go about your daily living. Remember, we are tilling the land. You're giving back to your body what is essential so that you're able to improve your efficiency and your functionality in life, so that you're living a pain-free life. Remember, there's nothing like normal pain. There are people who say, I'm old, I have arthritis, and this is something that I'm supposed to be going through. It's normal to have that knee pain because of age and all that. Forget that. Forget that. That doesn't happen. Remember, you need to understand there are changes that happen within the knee. You might be arthritic, but what is the structures that support that knee? When you strengthen your muscle, it supports the knee. When you improve on your flexibility of the joint, it supports the joint so that you are able to function pain-free. So it's all about giving back or tilling the land or doing what is necessary, what is important for that knee to function properly. So today we'll focus more on what we call patellofemoral syndrome. Remember, there are different causes of pain in your knee. You might be arthritic because of age or because of genetics. You might be, you might have had an injury while doing your sport in the gym or in the field. So probably you might have, you might be having a torn meniscus or torn collateral ligaments, or probably you might be dealing with a scar that you probably had an injury and you know not about. This is where we advise it's good to do a thorough assessment before you just jump in to do any kind of workout. You might be having a scar and you're going to do deadlifts. It will give you pain. You might be probably had a small tear from an injury which went untreated, and then you're going to do a deadlift. You'll increase that tear and it will do a complete tear on your either structures within the knee. You might be having a torn meniscus. There are now different ways of treating that torn meniscus, and you can work out with that, but you need to know what is happening to your joint before you aggravate it or you cause more damage towards it. There are orthopedics at Aga Khan, at Empisha, who can do a thorough assessment and advise you on what the problem is with your knee. And us as physiotherapists, we are best suited to rehabilitate your joints so that you're able to function properly. Today, I'll focus more on the people who complain about the knee pain. They've done the assessment with doctors and probably there's no problem with that knee, but still you're in pain. What happens? How do I go about managing or maintaining this problem? Remember, if the pain persists, visit us. We'll do a thorough assessment and advise you on the best way to go about it or refer you to the best person who is able to handle your problem. And remember one thing, for those who are probably the age has catched up, the knee has deformed and everything is just bad, surgery is not a death sentence. There are so many people who've done knee replacement and they are living their best life right now. It's all about strengthening the muscle. Once you have the knee replaced, you can strengthen that muscle properly. You can improve on the flexibility and go back to your normal life. The muscles are the ones which support that joint. And when you're given a new joint by these specialists who do this amazing work of knee operation, total knee replacement, you'll go back to your normal living. So knee replacement is not a death sentence. Definitely there'll be a struggle when you're doing the rehabilitation process, but at the end of it all, you'll be happy. You'll not have that lack of sleep because you can't turn, because the knee will give you that sharp pain and all that. No, you'll be living a comfortable life without the pain. So back on patellofemoral syndrome. The knee, the quadricep muscle has four strands. There are two on the outside and 2 in the middle. And these converge to form to make a common tendon, which is the quadriceps tendon, and they join up with the kneecap, which is a bone within the muscle, with a bone within that soft tissue, and the attachment, the end attachment between the kneecap and the bone below is the tendon, that is the patellar tendon. Yeah. So whenever the outside band is tight or the muscle on the outside is tight, there are so many people who suffer from even the IT band being tight. That outside part of the quadricep being tight will pull the kneecap towards the outside, and that will cause the kneecap to rub on the wrong surface. Sometimes it might be the inner part of the muscle group which is tight, and it will pull the kneecap towards the inside, pushing the kneecap on the wrong edge, and it will be gliding or moving on the wrong surfaces. Remember, the kneecap has its groove that is supposed to glide upon, the below groove and the upper groove. Yeah. So also, if the middle two muscle group of the quadricep are tight, they'll pull the kneecap up, which will cause the kneecap to rub against the surface, which definitely brings about this pain. How do I go about it? I'll give you a few tips on how to stretch your kneecap, and later in another video maybe we'll discuss the other conditions, say arthritis, and in case you have all those the knee operations. But for now, I just want to show you how to stretch the knee, how to put back the kneecap where it's supposed to be, and this will help ease the pain of when you're going up and down the stairs, when you're going up and down the slope, or those initial movements when you're standing up from maybe a workout, or just this is your normal that you normally get. Remember, there's no normal pain. That one I disagree with. You can sort that. You can till your land. Yeah, the same in our video that we discussed earlier. When the joint is not functioning well, there are ways on how to tweak it to make it function better without pain. It doesn't have to be, you have to use the medication now. Stretching can help. If you have advanced case of a knee effect, then medication is definitely very necessary. All right. Welcome to my therapy bed. I'll show you a few tips on how to go about it. And remember, like, subscribe, and share. There might be somebody who is really in dire need of this video and probably is not able to access the physiotherapy services or might be challenged with finances. This can help ease that pain and give them a way out on how to manage that pain or get rid of that pain completely and permanently. Welcome to my treatment table. There are 3 ways of stretching the knee and trying to push the kneecap where it's supposed to be. Mostly, I prefer if you're in a working area, there's no excuse where you can say, I can't because I'm at the office or I'm at work and all that. You just need your body. You just need a small space, even if it is in the sink, at the washroom or something. You can do these few stretches and you can get yourself out of this pain. We'll start with the first one. If you have a surface, let's say if it is your working table or working desk, or if you're at home, on the just at the edge of the bed, put your knees close to the bed, right? And then what you do is hold the toes up. Yeah, against, you're supposed to be able to bring your the heel of your heel should be able to touch your bum. If it is not able to touch your bum, then that joint is limited. So what do you want to do? First, keep your back straight. Pull the knee and the toes towards your bum. If it's able to touch your bum, well and good. And then what you do is pull the knee backward. Remember, keep the knees together. When you're pulling out, you breathe in, and when you bring it back, you breathe out. So you do that 3 to 5 times, and then you release the knee. You can do the other side as well, the same thing. Remember, what you do to your left, you also do to your right. So heel to your bum, toes pointing upward, and then keep your back straight and pull the knee away from the bed. And remember, when you're doing that, keep your back straight. You can also push your chest backward so that you don't bend. Avoid bending forward. When you're bending forward, you're compensating. It won't give you the correct stretch. So keep your back straight, pull the knee away from the bed at the same time, keep your shoulders straight, and you can pull them backward as well. Repeat this 3 to 5 times. The second stretch is the opposite hand to hold the toes so that your toes are pointing inward, right? If it is your right leg, the toes should be pointing towards your left shoulder. And then same thing, keep your knees together, keep your back straight, and pull the knee out and bring it back. When you're doing that, you breathe in and you breathe out. Yeah, incorporate your breathing so that you're able to relax the muscle as much as possible. Remember, the knee should be close to the other knee. Don't pull the knee outward and bend forward. That will be the wrong form of doing it, right? And then you do it also on the opposite side. Remember, what you do to your left, you do to your right. Pull the knee, the heel towards your bum, and then push your knee outward and back. While you're doing that, you breathe in and out. And the third exercise, your toes now to be pointing outward. So hand the same side. If it is your right leg, let your right hand hold it, and then point the toes outward. Again, pull the knee out and pull the knee back. While you're doing that, breathe in and out. Keep your back straight and the knees closer to one another. And what you do to your left, you do to your right. So the knees pointing out, yeah? Keep the knees together and your back straight. Pull the knee back and pull the knee out and back. All right? Push the knee out and pull it back. Breathing in and out. Remember, when you're doing these stretches, you'll have an immediate effect on the pain. And this will enable you now to be able to walk up and down with less pain. If it is not working, if you've tried this and still the pain persists, visit us at Most Physiotherapy Center where we'll do a thorough assessment and advise you on what is ailing your knee, and definitely you'll receive the best touch of care. We'll be able to assist you, we'll be able to help you. So even if it is referring you to an orthopedic, we'll be able to do a proper analysis so that you're able to solve your problem. Remember, there's nothing like normal pain. You cannot live in pain. It is something I work against because we are given this body. We're supposed to enjoy every minute of it, not enjoy while another pain is always bothering you from sleeping or from functioning properly. So visit us at Most Physiotherapy Center if the pain persists, and we'll be able to assist you and guide you through the proper rehabilitation and get you to your best functionality possible. Remember, here at Most Physiotherapy Center, you receive the best touch of care. And like, subscribe, share to that person who you know might be going through this or is going through this problem and probably has lacked the solution. You might be able to get a tip to be able to work on themselves and till they are learned.